Hi there, Dr. Carol White here from Functional Medicine Partners. In the last video, I discussed the relationship that we have with Fullscript for prescription grade supplements as well as personal care and cleaning products. I'm including the link to my dispensary below for the 10% discount. But why take supplements in the first place? Well, the simple reason is we most often do not get the nutrition we need from diet alone. This is where the supplements come in to make up the slack, essentially. These can range from vitamins and minerals to herbal extracts to amino acids. Each type of supplement serves a unique purpose, such as boosting your immunity, enhancing energy levels, or promoting overall well-being in general. So some formulations actually combine different ingredients together into one capsule or pill, so you end up taking less pills, which is always what we want. You may ask, so what are the basic supplements that I need? What does everyone need? Well, I can tell you it's individualized, but most often the majority of us are lacking really three things. We're lacking omega-3 fatty acids, we're lacking vitamin D, and we're lacking magnesium. So let's talk about those for a minute. So most people do not get enough fish in their diet. That's one of our major sources of vitamin D, or they just don't like it simply. And it's beneficial to our body in so many ways. Vitamin D helps to get rid of free radicals that cause chronic disease, and that's the biggest function that it has. Vitamin D loss can be damaging to the bones long term. It's considered a pro-hormone and it's made from cholesterol. Statin drugs decrease cholesterol, so that contributes to low vitamin D level. Sunscreens actually block out vitamin D absorption as well when we're out in the sunshine. So remember ADEK, A-D-E-K, as you're thinking about fat-soluble vitamins, vitamin A, vitamin D, vitamin E, and vitamin K. You may never have been told this, but fat-soluble vitamins actually need what to absorb? It's fat. One of the things I never learned in nursing or nurse practitioner school was to tell my patients they're taking vitamin D, specifically that you have to have it with food and specifically with fat. So I had to get certified in functional medicine to figure some of this stuff out. But I'm sharing that with you now. So vitamin D specifically needs fat. It also needs vitamin K2, and then it also needs magnesium. So you have three things that is needed actually to absorb the vitamin D. So butter in your coffee, which my husband does, a little olive oil, etc. If you don't eat breakfast, those things all work. So taking with food is also with anything, not taking it while you're cooking or within a half hour of eating. It means taking a bite of food, taking your fat-soluble vitamin, and then another bite of a fatty food or drink. Vitamin K2 helps ensure calcium is deposited in your bones and not in your vessels or other places. But those on Coumadin cannot take K2. So the other blood thinners, the research is showing that it's not as much affected because K1 is most responsible for clotting. So of the vitamin Ks, K2 tends to be the safer one, but again, you cannot take that with Coumadin. And again, always make sure you talk to your primary care provider about any supplements you're taking. And then the third one we talked about is magnesium. It's common. We lose magnesium with stress. We lose it with age and diuretic use. And we need it for nerve and muscle function, our bones, as well as mitochondrial function. So remember the mitochondria are the powerhouses of the cell. And so for cellular function, magnesium is desperately needed. So that's a good place to start. Vitamin D, magnesium, and your omega-3 fatty acids. So make sure always keep your supplements in a cool, dry place and away from sunlight, and do not use expired products. Also, there's an app that I love that helps you look at the safety and efficacy of supplements that you're currently taking. It's called Prove It. And you take a picture of the supplement, even from your own computer, and the app will actually tell you the quality of the supplement. So it rates safety and efficacy on a scale of 0 to 100. When my husband and I went to Costco last month, I actually was shocked at the low quality of the Kirkland supplements. I mentioned that in my last video. And I checked like turmeric, I checked CoQ10, and I was just really shocked at how bad those supplements really were. They just did not have as much of the ingredients in them as they should have. So, you think you're saving money by going to these discount stores and getting your vitamins, but if you're having to take twice as much to get the desired effect, or there's things in there that shouldn't be, then it's really no longer cheaper and it's not good for you. And then there's also situations of just weird stuff that goes into some of these supplements. I was in Florida several months ago. I went to CVS to buy some melatonin, and I thought, I'll just buy the CVS brand. I just don't need a little of it right now. And it had talc in it. I mean, that was so crazy to me that, I don't want to have talc going through my body. So be careful with your supplements, and better yet, buy them from Fullscript, a company with many, many supplements and brands that you can trust, that make sure that the supplements are safe, or they just don't deal with those companies at all. So again, link is listed here, and happy shopping, and I'll see you later.